So today we'll be talking all about infertility in men. So what is causing your infertility?
Hey guys, welcome back to Nicky at your Cervix. It's your girl Nicky here, and if you're new here, welcome. Don't forget to hit my subscribe button, turn my post notification bell on so you can get an update every time I have a new release. And follow me on Instagram at Nicky_at_your_cervix for lots more interesting content.
So, a diagnosis of infertility means you haven't been able to get pregnant after a year of trying. So, a lot of people think that infertility is a woman's problem. Guess what? Men can be infertile too. In fact, men and women equally are likely to have infertility problem. One study shows that 1/3 of infertility can be attributed to females, while men's problem account for another 1/3, and the remaining 1/3 is due to combination of both male and female infertility, or they have no known cause. So what is causing the male infertility? Generally speaking, this relates to the effective production of sperm, the sperm count or the number of the sperm, the shape of the sperm, the movement of the sperm, which includes both the wiggling motion of the sperm themselves and the transport of the sperm through the tubes of the male reproductive system. So all of these come into play when we talk about male infertility. And there are various risk factors and medical conditions and even medication that can affect fertility. So let's discuss these now. So the first risk factor is older age. So as you grow older as a male, you become more and more less likely to have children. If you smoke cigarettes, if you're a heavy alcohol drinker, if you're overweight or obese, if you have been exposed to toxins like pesticides, herbicides, and other heavy metals. So as it regards to the medical conditions, some examples can include retrograde ejaculation. This occurs when the semen enters the bladder, where that stores our urine, instead of emerging through the penis during orgasm. So basically the ejaculate is not coming out, it's going back into the bladder. Another condition is varicocele. This is a swelling of the veins around the testicle. Another one can be when the testicles have not descended into the scrotum. Another one is having antibodies that attack your sperm and destroy them, as well as a hormonal imbalance such as a low testosterone production. Some medications and drugs may include chemotherapy or radiation drugs which you use to treat your cancers. Something like sulfasalazine, which we use to treat rheumatoid arthritis or ulcerative colitis. Calcium channel blockers, which are used for high blood pressures, tricyclic antidepressant medications, anabolic steroids, which are used to improve athletic performance, or hormonal issues such as delayed puberty. Recreational drugs such as marijuana and cocaine can also impact your fertility. So if you've been trying to conceive and you notice that it's not working for over a year now, you should probably go and see your doctor. So your doctor is going to want to know if you're having any erectile dysfunction, if you have any problem with your ejaculation, if you have a low sex drive, if you have pain or swelling in the genital area, or if you have ever undergone a previous surgery in the genital area itself. So what we do is take a general medical history of what is going on to assess your overall health, your sexual history, as well as factors that could affect your fertility. Then a physical examination is performed to check your genitals for any structural abnormalities or any lumps that are there. So another thing that can be performed is a semen analysis. This is where your doctor will ask you to provide a sample of your semen, and this sample is then checked in the lab to see how many sperm are present, whether the sperm are shaped normally or whether they're moving properly. And depending on the results of your initial exam and your semen analysis, your doctor may want to perform additional tests like hormonal testing, genital ultrasound, and even genetic testing. So as in regards to treatment, the type of treatment you get for infertility generally depends on the variety of factors, include the cause of your infertility, if this cause is known, how long you've been trying to conceive, your age, the overall health of you and your partner, and the personal preference of you and your partner following the consultation with your doctor. So the treatment in men includes surgery, medication, as well as ART, what we call assisted reproductive technology. So what the surgery does is to fix any obstruction that are preventing the sperm from being present in the ejaculate. So you can correct the conditions such as the varicocele, and in some cases sperm can be retrieved directly from the testicles itself, after which it can be used in ART treatment. So you can get medication to treat the issues such as the hormonal imbalances that you may be having that causes your infertility, and these can be used to treat conditions like your erectile dysfunctions or any infection that may affect your sperm count. So as regards to ART, this refers to the treatment in which the egg and the sperm are handled outside of the body. So it includes in vitro fertilization or IVF, as well as intracytoplasmic sperm injection. So sperm for ART treatment can be received from your ejaculate or extraction from the testicle itself or a donor. And that's it for this video. If you have any question, don't forget to drop it in the comment section below. And do you have any problems with infertility, and how did you treat your infertility problems? Thank you so much for listening. Don't forget to like, comment, share, and subscribe to Nicky at Your Cervix on YouTube for lots more interesting content. Until next time, see you soon. Bye!